patient is a 42-year-old male that is unresponsive. Your partner's already established a line. His blood glucose level was 30.
All right, BSI is seen as safe. I'm going to ask my partner or ask the bystanders if there's any allergies that they know of.
None.
Okay, from here I'm going to go ahead and get my D50 out. So I'm going to find the D50 and I'm going to go ahead and assemble the syringe together. All right, I'm going to administer 25 grams. From here I'm going to go ahead and clean my site. All right, I'm going to confirm that I'm giving D50 25 grams. I'm going to attach it. I'm going to cleave the other end and I'm going to push it slowly. All right, once I'm done pushing, I'm going to open the line back up and I'm going to place this in the sharps container. I'm going to go ahead and let my flow keep going, and I'm going to monitor my patient for any adverse effects.
The skill is designed to evaluate your ability to recognize and verbally treat cardiac arrhythmias in accordance with current American Heart Association guidelines and algorithms. 4 separate static ECG recordings will be associated with the patient information and will be presented. I am not permitted to supply any additional information not contained on the cards. I will individually hand you each of the 4 cards. You may read the patient information out loudly or to yourself. You will first need to verbally inform me of your interpretation of the rhythm and condition. Then you must tell me all the treatments and interventions you would provide to this patient in the field. Assume that the rhythms you see in the 6-second strip continues in each patient and does not change. You may pass on any card and come back to it at any time. You will have a total of 6 minutes to complete all 4 of the patient encounters. Do you have any questions?
No.
Case 1.
This is supraventricular tachycardia, SVT. You respond to a 49-year-old female feeling faint and weak. Upon arrival, you find her sitting against the wall, awake, complaining of dizziness and stating, "I feel like I'm going to pass out." She has a weak, rapid pulse, and her skin is diaphoretic. Blood pressure is 100/60, respirations are 20. You place the patient on the monitor and identify the following rhythm. I'm going to go ahead and put my patient on 4 liters nasocranial O2. I'm going to put my patient to the monitor. I'm going to go ahead and start an IV. Since my patient is presenting with SVT, I'm going to go ahead and try vagal maneuvers. If that don't work, I'm going to go to adenosine. I'm going to start off with 6 milligrams IV, rapid IV push. If they don't convert, I'm going to go to 12 milligrams adenosine IV push. And after that, I'm going to transport.
All right. Case 2.
Case 2 is 3rd-degree heart block. You respond to an 84-year-old sick, elderly female. Upon arrival, your patient is awake and appearing weak. She states that she has been dizzy and very weak for 2 hours and finally passed out but quickly regained consciousness. Blood pressure is 84/60. Respirations are 26 times a minute. You place the patient on the monitor and you see the following rhythm. Okay, I'm going to put my patient on the monitor. I'm going to go ahead and apply oxygen, 15 liters a minute, non-rebreather. I'm going to go ahead and establish an IV. Since my patient is unstable with 84/60 blood pressure, I'm going to go straight to transcutaneous pacing. I'm going to go set the rate to 80 and make sure I have mechanical capture. After that, I'm going to transport.
Okay. Case 3.
This is VTAC, ventricular tachycardia. You are dispatched to the scene of a patient complaining of weakness and dyspnea. Upon arrival, you find a 72-year-old male patient lying on the couch, clutching his chest. He is short of breath and states that he feels like his heart is running away on him. You connect him to a cardiac monitor and see the following rhythm. He is cool, sweaty, and pale. You note a very fast and weak pulse. His blood pressure is 80/40 and respirations are 36 and labored. I'm going to connect my patient to the monitor. I'm going to apply 15 liters of oxygen on her breather. I'm going to establish IV access. And since my patient is unstable, I'm going to go straight to synchronized cardioversion at 120 joules and transport.
Case 4.
This is, rhythm is sinus bradycardia. You have a 69-year-old male complaining of lightheadedness when he stands up, denies chest pain or dyspnea currently. Blood pressure is, pulse is 50, blood pressure supine is 162, blood pressure seated is 88/42, and respirations are 16, O2 saturation is 89%. Patient is alert, cooperative, no JVD, heart slow. You think you might hear a murmur, bibasilar crackles in the lungs, and 2 millimeters pedal edema. I'm going to go ahead and apply the cardiac monitor to my patient, place them on 4 liters O2, my nasal cannula. I'm going to go ahead and establish IV access. I'm going to go ahead and administer, ask my patient for any allergies, go ahead and administer 0.5 milligrams of atropine IV push. Repeat every 5 minutes to a max of 3 milligrams. If that doesn't work, I'm going to go straight to transcutaneous pacing at a rate of 80 beats per minute in transport.
This concludes the examination.